will discuss a milestone regarding our COVID-19 vaccinations. The mayor will also discuss the reopening of the vaccination portal, the partnership with one of our healthcare partners, details on federal vaccination sites, and also discuss the opening of the portal to assist renters here in Orange County. Orlando Mayor Buddy Dyer is here to discuss supporting small businesses in the city of Orlando and also vaccinations taking place in the city and some of those sites. Epidemiologist Alvina Chu from the Florida Department of Health in Orange County is here to discuss details on the vaccination process as well as COVID-19 numbers and trending in our area. We begin the press conference with Mayor Demings. Mayor?
All right, good afternoon to all of you. Thank you, Dr. Williamson. Thank you, Mayor Dyer, for being here once again, and Ms. Alvina Chu from the Florida Department of Health at Orange County. We have a lot of exciting things going on in our community, especially as it relates to the increase of opportunities to get vaccinated. And yesterday I had the opportunity to go down to the convention center, and Ms. Karen Hill of Maitland here within Orange County received the 100,000th dose of the coronavirus vaccine at our convention center. And I believe on the picture behind me, you can see her there. She was very, very excited to receive her second dose. Dr. Pino was there to join me. Ms. Hill was a great sport about the whole thing. We presented her with some balloons and some other items from the convention center to memorialize the fact that she was our 100,000th dose recipient. The convention center site is extremely busy. I was able to witness that myself as workers are now vaccinating 3,000 individuals a day at that site alone. I had the opportunity to walk around and just express my appreciation to the men and women, the healthcare workers, the paramedics who have been working tirelessly now for several weeks, providing the free shots at the convention center. And they were upbeat, they were pleasant, they were on top of their game, and the process was truly a very, very efficient process. It is quite the operation, and each day I receive kudos from our residents about the experience that they had at our convention center. Speaking of vaccinations, on Monday, March the 1st, the appointment portal for the convention center will reopen at 9 a.m. Thousands of appointments will be available to anyone who is 65 years or older and who is a Florida resident. They can go to our website at ocfl.net/vaccine for more information. Also, while I was at the convention center yesterday, one of our seniors arrived via a Lynx bus, and there we are. You can see we're standing there. We appreciated the driver for getting her there safely, and this particular woman fit the eligibility criteria. She was extremely excited about receiving her very first dose, and so we're going to continue with that effort. As of today, 50 seniors have used the Lynx system to get to their vaccine appointments at the convention center. So as a reminder, if you have a confirmed appointment and do not have a means of transportation to the convention center, you can call 311 or you can dial the full number 407-836-3111. But if you're within Orange County, you can just dial 311 and you will get the call takers. An operator will coordinate with Lynx for the free ride, and there must be a 48-hour period of time in advance in order to get the appointment made. And by the way, the Lynx driver does stay with the person the entire time. Next Wednesday, March the 3rd, FEMA will open its vaccination site at the Valencia College West campus. They are preparing that site today. There will be some training opportunities for both the healthcare workers and the law enforcement officers who will be staffing that site. This is a federally run site which will operate 7 days a week from 7 a.m. to 7 p.m., and the site will administer some 2,000 shots a day. FEMA asked me to submit locations for smaller mobile satellite or spoke sites that will conduct up to 500 vaccinations a day. Starting Wednesday through Saturday of next week, that is the 3rd through the 6th, shots will be given at the Inglewood Recreation Center in Orlando, and then on the 7th through the 10th, vaccinations will take place at the Kelly Park in Apopka. Both of these sites will help us better respond to underserved communities as we address health equity concerns. To pre-register, please go to myvaccine.fl.gov, or you can call the helpline for Orange County residents at area code 833-959-0222. And I'll share a bit of additional good news. There will be another vaccination opportunity as part of our partnership with Advent Health. The Florida Department of Health in Orange County is allocating another 3,500 doses that Advent Health will distribute on Friday, March the 5th, at their pop-up site outside the Orlando International Airport. The vaccines at this site will only be available to those 65 years of age or older. Again, appointments are required. You can sign up right now on our website today at ocfl.net/vaccine. We thank community partners like Advent Health for helping us with our vaccination efforts in Orange County. To give you an update on how many people have been vaccinated, the Department of Health tells me that over 47%, to be precise, 47.2% of Orange County residents ages 65 and older have now been given at least one dose of the COVID-19 vaccine. We are getting close to now having vaccinated 50% of the eligible senior population. Countywide, over 8% of our total population has received at least one shot. I am certain that those numbers will start to increase as we continue vaccinations throughout our community. Since the start of the pandemic, there have been a reported 113,330 COVID-19 cases reported in Orange County. Our 14-day rolling positivity rate continues to slowly decline. Today, the 14-day positivity rate is 6.1%. Again, the healthcare experts estimate that when you hit the 5% or below mark, you have successfully contained the virus within your community. So that is the goal. Sadly, however, 1,091 residents have died from the coronavirus within our community. That is an increase of 19 deaths since our briefing this past Monday. Additional good news. On Monday, we are launching a new program to help Orange County residents who lost income due to COVID-19 and who cannot pay their rent. The Orange County Emergency Rental Assistance Program will distribute $33.4 million in federal funds to help predominantly low-income residents who are facing eviction. Both landlords and tenants must apply for this relief together. For more information and eligibility requirements, please go to our website at ocfl.net/rental assistance. Again, this is for Orange County residents, with the exception of the city of Orlando. City Mayor Dyer will talk about their effort there. The other municipalities within Orange County will be covered through this program. The Homeless Services Network reports that the data indicates the number of homeless persons in Orange County have declined. This is likely due to the moratorium on evictions and the various rental assistance programs that we have offered. Earlier today, I was invited to join a call with the National Association of Counties leaders from across the country. We discussed President Biden's economic stimulus package known as the American Rescue Plan and how critical it is for counties and cities to receive these funds directly. I've said many times that no one knows the needs of our local communities better than our local leaders. I hope Mayor Dyer agrees with that. I shared with the group how Orange County was able to quickly create programs with the $243 million in CARES Act funding that we received previously. I was proud to share how we as local county officials were able to get financial relief for our residents, businesses, and social services, as well as provide our community with personal protective equipment and COVID-19 free testing. Through these direct allocations, county staff was able to maximize funding, keep families in their homes, and help steer our community towards recovery. And now I'm going to turn it over to Mayor Buddy Dyer.
Thank you, Mayor Demings, and for any clarification, I do agree with you that those that are closest to the residents are best suited to be able to provide or need the resources to provide help to the residents and know the best ways to go about doing that. Also want to mention that the city flags will remain at half-mast through tomorrow and make clear that it is in response to President Biden's request that we honor the 500,000 Americans that have lost their lives due to COVID. And as we continue to approach the one-year mark of the pandemic, it's hard to believe that it's almost March and it's going to be a year since we started closing things down. But it's important to recognize how far we have come in fighting the virus and controlling the spread, especially by wearing our mask. I've seen healthcare professionals saying that wearing your mask and exercising the other pandemic precautions are almost as good as receiving the vaccination. And I think that's why our community has worked together so well as we've heeded those precautions. I'm grateful that residents continue to get vaccinated when possible, and I'm thankful to the healthcare professionals and first responders who continue their diligent efforts in providing the vaccine and testing services. I want to thank Dr. Pino and the staff at the Department of Health in Orange County who continue to work with our city staff in identifying locations throughout the city. Also want to highlight a couple of the sites that are opening in the city. Mayor Demings has already mentioned the federal government FEMA vaccination site at Valencia, and I appreciate his recommendation on the Englewood Center as a location. That's an area of the city that is in much need of some localized location or some locations that are within that community to receive vaccinations. Also on March the 7th, the State of Florida vaccine site will open at Shiloh Baptist Church, which is in Paramore. They'll have two events providing first doses on that first day, March the 7th, and a second day for second doses later in the month. We look forward to additional mobile vaccine sites as well. We continue to do our part to keep our community safe and prevent the spread, but it's equally important that we make an effort, a continued effort, to support Orlando's small businesses. They represent every genre, every interest, every flavor, every culture imaginable, and every one of them still continues to hurt because of COVID. And next time you have a want or a need, think small first. With a quick online search, you can always find a locally owned business that will provide the goods or services that you need. So when you patronize these businesses, you support owners and employees right here in our community. Many of the businesses have found new and creative ways to make their business safe, clean, and comfortable for their customers and their employees. I visited a spa that's full service over on Bruton Boulevard this morning that I felt extremely safe and comfortable being there, and would certainly feel free using their services. During City Council meeting, we voted on an amendment to an ordinance that would allow the city to reduce the penalty fees for delinquent business tax payments. We'll have a second reading at the March 22nd meeting. We will consider a resolution to reduce the $250 fee to zero, and we hope reducing this fee to zero will help provide some relief to businesses as they continue on their path to recovery. And in other efforts to support our local businesses, we also voted on additional rental assistance in the CRA to 10 additional businesses, and that brings the program to 47 businesses, $885,000. We did that in conjunction with the Orlando Economic Partnership. With that, I'll call on Ms. Chu.
Thank you, Mayor Dyer. Thanks. As the Mayor Demings had mentioned previously, we've had 113,330 positive cases reported to us since the beginning of the pandemic. The recovery rate remains at 96% still, and our 14-day rolling percent positivity rate is 6.1%, so aiming for that below 5%, as the Mayor had mentioned, as per the federal guidance. We've had 1,091 deaths reported to us, which is unfortunately 19 additional since the last time we spoke on Monday. The age range was 25 to 93 years old, with the median age of 70 years old. We extend our deepest sympathies to the families and friends of those lost to the virus. 10 of those were female, 9 were male, 11 were Hispanic, and 8 non-Hispanic. 12 had known underlying health conditions, and 7 had no known underlying health conditions. 1 date of death was from January, and 18 dates of death were from February. 4 of the 19, or 21%, have been reported with the long-term care facility residential address. As far as variants reporting, so we currently remain at 14 of the B117 UK variants reported to us here in residents of Orange County. As the Mayor had mentioned, the COVID vaccine appointment portal opens Monday at 9 a.m. Appointment portal will open at Monday at 9 a.m. And just as a reminder, these appointments are for Florida residents, full-time and part-time, who are 65 years and older. If you have not already, we encourage you to create an account now in order to be ready for Monday when the portal opens. So you can register in advance of the appointment being open, and then when it comes time to make the appointment, that process will be easier and faster for you, we hope. You can visit the CDR Health Pro website at www.patientportalflorida or patientportalfl.com. And as the Mayor mentioned, we celebrated the milestone of 100,000 COVID-19 vaccines given. And we thank the Mayor for being on hand to help us celebrate this event. To reach this milestone, it's been a team effort, and we thank our dedicated DOH Orange staff and our partners in Orange County, the Orange County Convention Center, and CDR McGuire. We've had a total of 221,082 doses administered. 510,000 were administered to residents of Orange County, and 218,000 doses for Orange County residents with at least one, that's people with at least one dose. And that's, as the Mayor mentioned, this is 8% of Orange County residents who are partially or vaccinated. We've administered 150,678 doses to those who are 65 and older, and this represents 47.1% of Orange County residents who have received at least one dose of vaccine. A few know before you go items before coming to the vaccine event. Please arrive no sooner than 30 minutes before your vaccine appointment time. Please eat something before arriving. Take your normal medication prior to a vaccination appointment, and if you're like me, make sure you use the restroom before getting in the car and coming to wait. There are facilities available, but it makes things easier on you and your bladder. So, as a reminder, stay home if you are sick. So if you are experiencing any symptoms that are COVID-like, or if you are known positive, if you are positive for COVID-19, please stay at home and isolate for the recommended 10 days from the onset of your symptoms, or 10 days from the start of your positive test. And also, as a reminder for your close contacts or those persons who may have come into contact with you and been exposed, They should stay home as well with you, and for the quarantine period, the recommendation is 14 days from their last exposure to your infectious period. So with that, I will be happy to take any questions and turn it over to Mayor Demings.
Okay, in addition to Mayor Dyer and Ms. Hsu, we do have an audience. If you have any questions about the rental assistance program, we have Ms. Diane Arnold here, who is our manager that's kind of shepherding that program for us. We also have Mr. Scott Howard here from the Orange County Public Schools. If there are questions about that, we have Mr. Tim Boldick. If there are questions about compliance team types of efforts and what they're seeing, he's here. And we also have Commissioner Maribel Gomez Cordero, who is here to answer the most difficult questions. And if we need to translate into Spanish, we have Ms. Ilia Torres, who is able to do the translation for us today. And with that, we'll open it up to you for questions. And we have Ms. Lauren Seabrook, as usual.
Yes.
It's going to be for you.
You got it. Thank you, Mayor. Alvina, I know it's been probably a couple of weeks now, maybe a little bit longer, that we've seen the numbers really come down after the big spike we saw over the holidays. But we're still seeing some days where the deaths are quite high. Do you expect that to continue to last, or do you think we're getting close to where those numbers the death numbers will come back down the way we've seen just the general cases?
We're optimistic that the persons who are, experiencing the most severe outcomes from this illness, that number will decline, especially as the number of vaccinations increase in our most vulnerable populations, and as we continue to see the good downward trends. So we're optimistic that the downward trends represents us working together to get a handle on controlling the pandemic.
Troy Campbell with News 6. This question is for Alvina and Mayor Demings. On the heels of what's expected to be the approval of the Johnson & Johnson vaccine, and also understanding that you never really know what you're going to be allotted at any specific time, what's your level of optimism as we're on the heels of what's expected to be this approval of a third vaccine?
I'm optimistic that means we will be able to increase the amount of vaccines that are available to our population, and hopefully soon be able to increase the eligibility for those in the priority phases. And I'm encouraged. I'm personally, as an epidemiologist, encouraged by the single-dose Johnson & Johnson, which makes it easier for people to get the full protection with a single dose. Thank you.
Yeah, I would concur with Ms. Chu that it will only increase the available inventory, which allows us to better meet the demand. So far, the demand has significantly outpaced the supply. So by having Johnson & Johnson with a single dose, I think that the last numbers I saw said that it had about a 66% effective rate in preventing the virus from developing in a human being. So, but with one dose, I think that's, for many, that's exciting. So I'm just looking for the day when we have widespread availability of vaccine, regardless of the pharmaceutical type here within our community.
Hello. Afternoon. Edgar Carrillo from Telemundo. I have a question for Ms. Alvina. Recently, the chairman of the board of the Union of Surgeons in Puerto Rico said that approximately a third of the cases associated with children in the island are somehow connected to their traveling to Florida and specifically to coming to the theme parks in Orlando. Why would you respond to this? Are the measures taken here, the parks, more than enough to prevent the spread, or is there some way that the doctor in Puerto Rico is somehow misinterpreting the statistics?
So we've worked with the theme parks, many of the theme parks, to put into place good pandemic precautions to be able to safely reopen.
Do you want it in Spanish?
In Spanish, or do you want all in English?
Okay, so then we have to kind of
Trabajamos con los parques temáticos para implementar medidas de seguridad y precauciones pandémicas.
Sorry, it breaks the train a little bit. So we've worked with the theme parks. The contact tracing that happens is, the responsibility of it is based on the jurisdiction of where the person lives.
Trabajamos nuevamente con los parques, pero el rastreo de contacto que realizamos se basa ciertamente o se restringe a la jurisdicción en la que trabajamos.
And so when there are exposures identified, if there is some link that is outside of the jurisdiction, that normally that kind of information will be passed on for follow-up.
Cuando se identifica un contagio que está fuera de la jurisdicción, entonces se transfiere entonces ese contacto a las autoridades locales.
And we haven't in Orange County received any information of that type linking to any transmissions associated with any theme parks.
En el condado, por lo que se conoce, no hemos identificado ninguna transmisión que haya ocurrido dentro de los parques.
And we haven't identified any cases of transmission associated with attendance at a theme park.
Recalca que no han identificado contagios de transmisiones que hayan ocurrido dentro de los parques temáticos.
Thank you.
Danielle Lama with Fox 35 for Ms. Chu. Both California and New York have reported new concerning variants. What can you tell us about those? And are we testing for those variants here, or have we found any additional ones in Florida?
So we have not yet identified any of those ones that have newly been identified in New York and California. Currently, we've only identified the UK B117 variant. The lab testing isn't conducted necessarily here, so I can't specifically say as to whether or not we are specifically testing for those. As we had talked about in previous conferences, so we expect that the variants, that the coronavirus will mutate and accumulate mutations and become variations of what the wild type or the original strain. And so there is a lot of sequencing being done across the United States, and also the Centers for Disease Control and Prevention have put out a plan for national virologic surveillance to track the mutations that accumulate, and then try to identify as to whether or not those illnesses, if there's more or increased transmission or increased virulence or severity of disease. Thanks.
This is Steve Huder from the Sentinel. This is for Alvina Chu as well. When I had a conversation with somebody today who said to me, Johnson & Johnson is only 66% effective. And they emphasize the word only. So can you put that in perspective for some people who might say, well, why go through this? It's only about half effective.
Right. So I think if Johnson & Johnson had come out first at 66%, we would be ecstatic. It's the data that have come out from those clinical trials have shown that that vaccine as well, there have been no hospitalizations or deaths associated with coronavirus illness after receiving that vaccine. And I'd also like to say that, a clinical trial is not the same thing as like what happens in the field. And so the single-dose Johnson & Johnson is, it's a boon for us to be able to have in our toolbox to help prevent additional illnesses or additional infections. And so because it's single-dose, and also because of its storage temperatures. And so those kinds of requirements makes it easier to administer and get people the full protection in a single visit. As we continue to add these tools to our toolbox and to continue to practice our pandemic precautions, I think we're optimistic we'll be able to get a handle on the pandemic, and that we'll soon be able to return to some kind of normalcy.
This next question was texted in from Bob Hazen from West 2, and this is for Alvina Chu. Question reads, have you determined exactly how the two women who allegedly disguised themselves to look older were able to slip past the screening process to get the first dose of the vaccine? And have any measures been put in place since to prevent a repeat?
Right, so we've been working with our Orange County Sheriff partners and also our partners at the Orange County Convention Center to institute additional measures to ensure that those persons who are coming meets the eligibility criteria for the priority for the vaccine. So it includes checking for age, the 65 plus is those who are eligible at the convention center, and also for the residency requirements, so Florida residents. Thank you.
This next question comes from Sam Sosa, directed to Mayor Demings. Her question is in relation to the federal site and the members of the U.S. Army that are deploying here to Orlando. So her question is, with 130 soldiers from the U.S. Army deploying to Orlando to help with the whole of government vaccination efforts starting tomorrow, what does this mean for Orange County residents, and can you provide any insight with how many vaccines in total we can expect coming to the area soon between local, state, and federal efforts?
Yeah, this is a coordinated effort between the federal, state, and local governments to come together. The reason why you have the military personnel coming is that they're there for logistical support. There will be a requirement to set up tents, tables, and other things for the sites in question, and that is the reason why they are there. So it helps to relieve us because we are supporting multiple sites and locations now, but this was all part of the comprehensive plan to make certain that we were inoculating thousands of people here within our county.
This next one is for you too, Mayor Demings, from Lauren Cervantes. Her question reads, what is the economic impact of having Cpac in Orange County? How much money could it pump into the local economy?
We do have the numbers. I didn't bring the numbers with me, but we can get that to her. It's a multi-million-dollar economic impact. I can tell you that. I just don't remember the precise number, but it's a multi-million-dollar economic impact.
This next question is for Mayor Dyer from Ryan Lynch in the Orlando Business Journal. His question reads, how long do you expect some of the programs like Parklets and enhanced outdoor seating to last? As the pandemic's influence eventually slows down, do you expect them to stick around?
I do. A couple of council meetings ago, we extended all of those business help programs that we instituted in the spring of last year. We extended those through the end of August. So you can expect to have those at least through the end of the summertime.
This next question is for Orange County Public Schools. I believe Scott Howard is here. This comes from Kelsey Third from West 2 News. Her question reads, Scott, are you able to confirm that several 7th grade in-person students at Sunridge Middle School are in quarantine? And if so, what is the cause of their exposure?
Not sure their cause of exposure. That was over a week ago, and we handled it. I believe all those students are back who were quarantined during that time.
Thank you. And this last one comes from Melissa Thomas from Mayor Demings. Melissa Thomas with Florida National News. Her question reads, Mayor Demings, Governor DeSantis recently approved more vaccination locations in several counties and today approved a site as close to us as Osceola. Do you feel there are any obstacles in him approving a location or state-run location in Orange County?
What has happened within the recent week or so is better coordination and communication between the Florida Department of Emergency Management and our local governments. In terms of site selection, we are directly engaged in the process of determining sites within our respective jurisdictions. That looks like that's the final question. Hannah is a young lady that has been moving around with that microphone. And let me just say, God bless Hannah, because I couldn't move around and sit on the floor like she's doing and then jump up as quickly to move around. So she does it seamlessly. So thank you, Hannah, for what you're doing as well. To make sure that you all are heard. Thank you all for being here. Our next press conference is scheduled for Monday, 4:30 p.m. Look forward to seeing you then. We hope you have a safe weekend.